At a time of heightened federal public scrutiny at the agency due to their abuse of children, it's really disturbing to me that we're here today for this reason, because it feels like we're allowing this agency to reposition themselves as the victim in this narrative. And it's working, because we're not talking about the abuse that children are enduring today. Instead, we're talking about how to make conditions even harsher for kids. And so even though this is not a he said, she said, because frankly, one side is adults and the other side is children, I think regardless, y'all should know about the recent staff to youth assaults that are occurring. So in 2022, right, shortly after the investigation by the DOJ, 2023 as well, we had in 2022, 3,400 roughly assaults from staff to youth, uses of force. In 2023, it was 5,911. In 2024, it was 7,050 uses of force from staff to the kids in the facilities. That's I know we talked about numbers earlier of the youth that are assaulting the staff, but I just want to also name how much more a staggering amount more of assaults from staff to youth are happening right now. And then specifically with the bill, I'll just name that we believe that it fundamentally contradicts some of the very important Supreme Court decisions that have been made in regards to how we should treat youth in the criminal legal system. Roper v. Simmons, Miller v. Alabama, all of these outlined the hallmark features of youth that make them different substantially than adults. They have limited capacity, culpability. They have, than adults, they have limited maturity, decision-making, and more susceptibility to peer pressure. All of these things are important, but most important is their capacity for reform, for rehabilitation, which is also different than that of adults. Additionally, we know federal mandates such as PREA make it so that youth who are housed in adult facilities must be sight and sound separated from adults, for their safety, which makes sense, but also leads to solitary confinement, which the agency talked about earlier that they've been working so hard to move away from. This bill would make it so that more kids are held in solitary confinement. And then, of course, you've heard the tragic stories today of Joshua Beasley, of Valentino Valdez. There's so many more who I wish could be here today. But we believe that this bill, unfortunately, will tragically create more of those kids. And I know that Chairman Cook is not your intention. I know that you've been visiting the facilities. You have been diligent about this issue for a long time. And I would love the opportunity to speak more with the committee about alternatives that we have to keep both youth safe and staff safe at the same time.
What are those alternatives?
So I used to work as a special education teacher, actually, and I worked with kids with learning disabilities and kids on the autism spectrum who oftentimes behaviors would manifest in violence. So I am a person who, even at 5'1", and before this used to be about 100 pounds, I had attempted stabbings from kids, and I worked with kids all the way up to 21, right, because this was a place for kids with IDD. And stabbing, hitting, kicking, biting, things thrown, kids trying to tie things around their necks, all the same behaviors that we see in TJJD, I saw in the school that I ran. But the difference is that the school that I ran, so we had extensive de-escalation training, and we had an incredible ratio of teachers to youth. And that made it so that when I needed to tap out, someone else was able to tap it in for me. But most of the time I didn't need to tap out because I was trained in de-escalation and could prevent these things from happening, most of the time. But we never once had to call in the police or exclude a child from our program in the 5 years that I taught there, at least. And it's because of the incredible support and also the philosophy that we came into this with. We weren't supposed to be bringing down the hammer on these kids, right? We were there to teach them and to help them learn how to behave, because as someone that I admire who who has actually worked in the correctional system for a while says, if I have a child and I speak only English to him in my home, and then one day I say, speak French, speak French, and he doesn't, and then I slap him and I say, speak French. And then I slap him again and I say, speak French. He's not going to be able to speak French because kids cannot demonstrate behavior that hasn't been modeled for them. It's just simply not possible. It's our job as adults for us to guide them and teach them the adequate social emotional behavior that they need to be successful in life. And for kids who have endured tremendous trauma, victimization in their lives, they are starting at a really far behind place. And so it's incumbent upon us, it's even more responsibility for us to come in with more gentle, more age-appropriate and developmentally appropriate alternatives to show them how to model the behavior that we want to see from them.
Like in the instances that, I talked about earlier, I mean, do you really think that's going to work with someone that's committed 15 assaults, of an officer?
I do. A lot of times that the children that I worked with, their parents came and went into debt to use this program because their child had been acting out so much, because their child had been removed from the traditional school setting, right? But most of these parents were quite wealthy, and so they were able to, through their support networks, avoid the criminal legal system, thankfully. But one of the reasons I got into policy for this work is because I knew that I can still see their faces. Those kids that I worked with, had they not been wealthy, would be in TJAD right now. And instead, I had the students go from that type of behavior in one summer to laughing, telling jokes, socially, in a much better spot socially. So I believe deeply, deeply, I'm convicted in my belief that kids can be rehabilitated, even kids with the most difficult behaviors. We can work with them and give them the care that they need to be successful.
So you talked about alternatives, but you said that you'd be glad to talk to us about alternatives, but I don't know that I really heard any alternatives. I heard de-escalation training, maybe, and anything else that you would like. And I know we don't need to get into it.
Sure, I can give you just the basic summary is that communities know what they need, families know what their kids need, and we should be relying on counties. There's actually a bill, I know we're not talking about that today, but 2489 that talks about investing in communities so that we can start to look at more centralized, individualized options in each county. I heard one of the probation chiefs here before talk about one of his kids who he wishes he could have done something different with, but there was nowhere else for that child, and I think that's an unacceptable answer. Right now, the Judicial Commission on Mental Health is working on sequential intercept model mapping, which is a process where we work with all the different practitioners in a county to identify where is the gap here that's leading your kids or adults to incarceration, and how can we meet that gap. That's what 2489 would do, is consolidate all those recommendations and bring that to the legislature. We need a process,
so
whether through a bill or
you
something
can
else.
You can talk about it, just talk about it as a suggestion, just don't talk about that particular bill.
Sure,
We can only talk about HB 3360.
Okay, well,
But if you want to make a suggestion,
what we think would be
I'm asking you to make suggestions.
The suggestion would be to work with those counties, work with all the different stakeholders, both the correctional practitioners and mental health, teachers, parents, to develop the solutions, the alternatives that we need so that we don't have continually probation chiefs coming up here saying, I didn't want to incarcerate this kid, but I had no other option.
Members, any other questions? Mr. Wood?
Thank you for your testimony. And earlier you had said you had the resources where you work last. You had the resources that if you needed to tap out, you could. Why is that being able to tap out? Why is that important?
Because I'm also a human being who has emotions and reactions and responses to things in my environment. And while I am a well-adjusted adult who has learned how to deal with my emotions, even for me, sometimes that rises to the level of needing to step away and take a break, right? And so think even more so of the kids who are in a stressful environment, their need for respite.
And if you couldn't tap out, you would get increasingly more frustrated and more angry.
Yeah,
right?
Absolutely. If I was trapped and locked up in that situation, yes, I would get more frustrated.
As a worker, as a person who is in charge of other human beings, like you have your emotional well-being as well.
That's exactly right. Yes.
And and you've read the DOJ report.
Yes.
And in some of that report, can you see where there's like incidents where you can clearly see like this is a staff who basically like was at their wit's end, and they didn't mean to do something, but like they were just at their rope, right, at the end of the rope.
Absolutely.
Yeah.
There's one story of a girl who says that she's feeling suicidal, and so the officers ask her to remove her clothes so they can put her in the vest that's used for kids who are suicidal, and they start commenting to one another that, oh, I feel threatened. I'm going to spray her. And they warn her, I'm going to spray you, and they do, because she didn't want to change out of her clothes, understandably. But that's something that I'm sure if those staff members watch that video back, they would be ashamed of. These are people who get into this work to help kids, right? And so we're not here to demonize anyone, but people have their limits and need other resources.
So I think one of the things we talked about is like maybe one of the biggest things that we can do is make sure that TJD is adequately staffed so that their people are not pushed to these limits where they would have to be put in these situations where they would end up doing something that they would regret later.
That is one option, and another option is to make sure that our counties are adequately staffed with the appropriate providers that kids need, both in their schools and out in the community.
Thank you.
All right, thank you for your testimony, Ms. Castillo. I'm sorry, Sheriff Lauterbach.
Just real quick, have you ever worked in a juvenile facility?
No, sir.
So this is coming from a teacher perspective?
My perspective on children with behavioral challenges and my direct experience with children with behavioral challenges does come from my experience as a special education teacher.
It seems like that you were calling a use of force incident an assault. Is that what you were saying?
Yes. And
That's inaccurate.
okay. The statewide use of force instances, manual restraints, mechanical restraints, use of chemical agents, and those are the numbers that I was reporting on that have risen to about 7,000 this year.
Two very separate things.
Oh, that's true, and I'm glad you noted that because I know the TJD representative earlier mentioned that, most of the things that have been reported or complained about have been in line with policy. So there is a difference in perspective about from an advocate like myself about what is appropriate use of restraint for a child versus what the agency does. I should acknowledge
We
that.
don't want to leave that perception out there. That's incorrect. Thank you.
Yes, sir.